Hello, in this video I'm going to explain exactly what happens on a session with me to overcome driving anxiety. If you don't know, I work with people online all over the world to help them overcome their fear of driving. And one of the most common questions people ask me is, what actually happens on a session? Many people say, well, I've watched loads of your videos and it's all great, it sounds brilliant, and I've seen the results you've got. But how do you actually do it? What really happens when I book a session with you? Well, the way I'm going to explain this is by telling you about a client that I worked with recently, and I'm going to give you the chance to see if you can work out what their cause of their driving anxiety was and see if you could be a therapist. So let's start off. Let's assume that someone's contacted me. They say they've got a fear of driving over 50 miles an hour. It's a very common thing. People say, I've got a fear of driving on highways, motorways, freeways, whatever you call them, wherever you are, because I work online with people all over the world. So let's say that a client's come to me with this problem and they have a quick call with me. I make sure I can help them. We make sure the internet connection's good and that we get along with each other and everything's fine. They've paid for the session and they turn up for the session. What actually happens? Well, you need to understand, I'm going to keep this quite simple because you can get complicated, but there are two ways that people can talk to you. There is the conscious way, which is what I'm doing now. I'm just talking to you and I'm thinking about what I'm saying and I'm being very deliberate and I'm thinking I'm going to say that and I'm going to say that. And at the same time, do you notice then my hands are moving around like this? This is the subconscious or unconscious mind. I'm thinking about it now, but a few seconds ago I noticed I caught myself moving my hands. And why was I doing that? What was I moving my hands for? I didn't know I was doing it. We all do this. We talk with our hands like this. And if you say to someone, what are you doing? They don't know. So you see, when you talk, you're always talking in two ways. There is the conscious mind, and I'm doing it again. The conscious mind is talking with your voice, but the subconscious mind, which is where the problem lies, is often doing other things like this to express itself. So, when you talk to someone on a session, I sit here and I'm on my phone and talking to the client on my phone, not being rude, and talking on my phone at the same time. I'm talking to them and we start talking about the problem. So I might ask you, how long have you had this problem for? You know, what exactly happens? Quite a few questions I might go through. And as you're talking to me, I'll be looking at what you're doing and listening to what you're saying. And there are certain things that I'm looking and listening for that will tell me what the cause of your driving anxiety is. So what I'm going to do, before it starts getting too confusing, is I'm going to give you a bit of a role play example now. I'm going to talk to you as though I am the client. Imagine you're the therapist and you're talking to me online on the other side of the world, or just round the corner. And I'm going to tell you what I think the problem is. And I'm actually going to do what this client did. And the answer to why they had driving anxiety is in this little clip. So what I'm going to do is I'm going to become the client now and I'm going to tell you what they said. So as a therapist, I asked them, can you tell me what the problem is? And this is what they said. Well, I've been driving for years and I can drive around town and I feel absolutely fine. But it's really funny because whenever I go into a fast road and I'm going over 50, something really weird happens. I just feel panicked and I feel stressed and my stomach starts hurting and I get headaches. And I don't know why, because I've been driving for years and I've never had a problem and I've driven all over the country. I've driven hundreds of miles and I just don't know what the problem is. Did you spot from that what the problem was? Now, you probably didn't, because you'd have to be a very good advanced therapist like myself to spot it, or you'd have to get really lucky. But the answer to that person's problem was in what was just in that little clip. If you want to watch it back, go and play it back, see if you can spot it. Before I give you the answer, I want to make a really important point. When people have driving anxiety, they very often do things like go to see a driving instructor. There is no way that a driving instructor would have been able to spot what the problem was just then. And I'm not being disrespectful. I've been a driving instructor for over 20 years. I've trained hundreds of instructors, and that's how I know they wouldn't spot this, because they would focus on the driving. They'd be taking you on different roads and say, how do you feel on this road? And it's really common for people to come to me having been to driving instructors, and they often use the same phrase. They say, the instructor gave me a clean bill of health. It's funny how many people say that. So that's why instructors can't help. And also, if you go to a cheap therapist, the kind of typical poorly trained hypnotist who's going to sit there and say, close your eyes, you are going deeper and deeper and deeper, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, you are so relaxed and calm, and then they get a book out, you are driving your car, and you are feeling good, and you are feeling calm, and you are a good driver, relax, 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 you are a confident driver. Rubbish. How would any of those things, driving or therapy, have ever got you to what I'm about to tell you now? And I know you're all probably shaking your fist at the screen saying, get to the point and tell me what this is. What was the problem? Well, did you spot that when I was talking about the problem, go back and watch it, and with my right hand, I went like this. Did you notice that? When I was talking about driving over 50, I went like that. Now, some of you may have spotted that. Well done if you did. But what would that have to do with a fear of driving? Well, this is where 99.9% of people would just fail to see that and miss it, and the session would fail. So I asked him the question, what did you do just then? And he said, what do you mean? I said, well, what did you do? What just happened? He said, I don't know. It was important I asked him that, because if he'd have said something like, well, oh, sorry, I just had an itch on my hand, I've hurt my hand when I was out in the garden, then it wouldn't have been important. The fact that he didn't know what he'd done was really, really significant. And I said to him, did you know you just touched your wrist like that? And he said, what do you mean? And I said, well, you do know that you just went like that with your hand, you just touched your wrist. And he said, no. Now, we did other stuff. I'm not going to tell you everything because I'm not going to give away all my secrets. I'm not even allowed to, because I've agreed not to with the person who trained me. We went through a short process, and he said, oh, well, funny thing that actually, because thinking about it, yeah, I used to have this watch that my daughter gave me, and it's really annoying. I've lost it and I can't find it. I've been looking for it for ages and I don't know where it went. And I said to him, how long exactly ago was it that you lost that watch? And he said, oh, well, now you mention it, it was about the same time his problem started with driving. Boom. That was the cause of his driving anxiety. He'd lost his watch. Now you're probably thinking, how can that have anything to do with driving anxiety? I will stress the point again before I tell you. This is how you get rid of it. It's nothing to do with driving, car crashes, nothing to do with relax, you feel so calm. Rubbish. The watch was the reason he had driving anxiety. You see, he'd lost this watch that his daughter had given him, and in his mind, subconsciously, he didn't feel safe without it. Now, you're probably aware that there are people who do superstitious things, like they won't walk under ladders, or there are people who have to wear the same clothes on certain days, or they have to lock the door twice before they leave the house. It gets programmed into your mind that you've got to do that to be safe. His mind had linked this watch that his daughter gave him to being safe driving. And there's no tragic story here. His daughter hadn't died or anything. It's just she'd given him this watch and it meant a lot to him, and he'd lost it. Now there's a lot more to it than that, but I won't go over the whole thing. I'll be here for months just explaining it all. But his fear of driving was about the watch, which I noticed because when we were talking, it went like that for a split second. So when people ask me, why'd you do this over Zoom? Why can't we do it over a phone call? Because on a phone call, I wouldn't have known you'd done that. There are other ways you can do it with audio only, but it's much tougher. Now that is just one thing, and I will plead with you, please don't think that you're now an expert therapist because I've told you that, and you're going to be going around looking for people doing this and doing that. Just because someone scratches their ear doesn't mean that their ear is the cause of their driving anxiety. Just because someone sneezes doesn't mean that's the cause of their driving anxiety. It takes a long time to perfect this and to practice it. There are many, many other ways it can happen. It can be things people say, things they do. Sometimes it can be something completely unrelated. But this is why this job fascinates me. In case you wonder why I no longer do driving lessons or only the odd one here and there, this job's fascinating when you learn how the mind works and how this happens and how people form phobias and fear and how you get rid of it. Then that's brilliant. It's amazing. It's incredible. And the way we got rid of it was simply to make him realise that losing his watch didn't mean he couldn't drive. And he went out and he drove his car and he didn't know what the problem was. And yes, he did find the watch eventually, so it all worked out well. But yeah, that was it. And guess where the watch was? Yep, in his car. Maybe that had something to do with it. We'll never know for sure, but it was in the boot of his car or the trunk of his car if you're American. So yeah, that's what we do on a session. So we chat online and I'm watching you and listening to you, but I'm not really listening to what you're saying. I'm listening to what your subconscious is saying. I will have made another video about this, but it's about how you can't possibly know what the cause is. It's funny when people come to me and they say, I've got this problem and I know what's causing it. And I think, no, you don't, because if you knew what was causing it, you wouldn't have the problem. But that is for another video. So that's what happens on a session. We chat, we talk. Sometimes, rarely, I do things like getting people to close their eyes and imagine things, but you don't need to. Interestingly, just as a final point before we finish this video, you might realise, if you're a therapist, that the thing about the watch, what we did was actually did a regression. So you might have heard of regression therapy, where people shut their eyes and say, go back to when you were a child, can you think of anything that caused this? And he might have said, oh yeah, well, my watch. It may have come up, but you see, I do it in an advanced way because I am now an advanced therapist. I've gone way beyond the standard. I've spent the last 2 years training all day, every day, because I couldn't go out of the house for much of the time. So yeah, I use methods which are really quick, and that's why I can get results very often in under an hour, whereas your average therapist might be doing 10, 20 hours, and you're still going. So that's what I do, and if you want to work with me, there'll be links in the description so you can book an appointment with me. Check out these other videos on the screen for more help with your driving anxiety. Thanks for watching. Subscribe if you've enjoyed this video, and as always, I'll see you again soon for more videos.